Thank you very much, Governor Raja Mohan. He's here, I understand. Thank you for being here. President Dinesh, all distinguished Rotarians and guests, thank you very much for the nice introduction, Past President Mohan. I have to know that Past President Mohan is one of my teachers right in the beginning, back when I wasn't even the president yet, when I was the president-elect. So thank you very much, PP Mohan, for being so unflappable and for helping the club all the way until now. Truly appreciate all the work that you've done for the club.
Thank you.
I've been asked to talk about a topic which is very dear to me, about a Rotary Foundation. The first thing that I want to share with all of us here is that the Rotary Foundation is a charitable arm of Rotary International. I always like to start my presentation with that because sometimes there's some confusion in the minds of some of our Rotarians that Rotary International and Rotary Foundation is one single body. It is not. The foundation has its own trust and its own trustees and its own chair, and it makes its own decisions and it has its own set of accounts. And it does not depend on subscription that you pay or the district pay or your club pay for you. That goes to Rotary International. Now, some of the things that has been done, the Rotary Foundation is not only known for its work with global grants, but it's also known for its work in polio eradication. I think there was a lot of information and highlights about polio when we had our World Polio Day on the 24th of October. It's also involved in educational grants for peace scholars, for scholars like Yuta Momose, for example, who's here on educational grants through the global grants. And of course, it's well known mostly for its humanitarian grants, of which I'm here to talk to you about. The humanitarian grants that are concerned here is what we call global grants. And global grants itself, for those who are here and hearing this for the first time, comes in different aspects. We can do it as a vocational training, we can do it as a scholarship grant, but mostly what we do is the humanitarian grant that we know as the approved global grants. The mission of Rotary Foundation is simple: doing good in the world. I don't think there's anything wrong with that. I think it's a very noble mission. It is something that we always refer to whenever we talk about the Rotary Foundation. And of course, the vision is to make the world a better place. I'd just like to give you a summary of what our club has done over the years since 2013. The 1st July 2013 was when this global grant system was completely overwhelmed, completely changed from the previous matching grant system. And it has continued as it is very, very successfully for the past 7 years. So we've been involved in about 90 grants that have already been approved. Later you will see there are some more grants which are currently in the draft stage. And we have 6 grants which have already been submitted waiting for approval. We have our presence in 14 different countries, and the project value for all our 90 approved grants is about $6.5 million. How do we do it? How did we do it? It's through all the generosity of all our members in our club, and as well as all the friends of the Rotary Club of Singapore and all the partner clubs, and a number of you are present today, and I'll take this opportunity to thank you as well. Now, again, a background: the Rotary Club and Rotary Foundation are encouraged to do projects in these 6 areas of focus. It is a broad enough focus, and all our projects, as far as global grants are concerned, has to fall within these 6 areas of focus. Now, what do we mean by a global grant? The first thing that we have to remember is that the global grant needs a minimum budget of $30,000 US. Now, it can be a bit challenging if your projects are small, but you need to scale. The reason is because there are a lot of work that's being involved. The approval takes pretty exhaustive reviews before it's approved. But the reason is very simple. If you are the guardian of $1 billion in TRF, the Rotary Foundation, you will be just as exhaustive when it comes to approval of any grants. But the basic principle remains the same. Identify a vulnerable population. It can be anywhere. Doesn't matter whether it's in Singapore, it's in the US, it's in Indonesia, Philippines, wherever you go, there will be a vulnerable population. About prisoners, we're talking about ex-prisoners, we are talking about disabled children, we're talking about the elderly, and these are the vulnerable population within our midst. All right, you must include some training elements. The reason is because giving gifts itself, whether it's chairs, tables, or books, doesn't make the project sustainable. And you must also aim for lifelong skills. You got to teach the beneficiaries something that they cannot sell the next day or the next week or the next month, something that can stay with them for as long as possible. And with all this, you have to make it sustainable. And sustainable means when the money runs out, when you leave the country, when you leave the project site, the benefits of the project will still continue. Let me take you on a journey. Just sit back. Let me take you on a journey of what our club used to do in the 40s and 50s and the 60s. This is a newspaper article of a Rotary Tuberculosis clinic that was mooted by our club in 1948 and covered extensively by the press. Our club raised quite a bit of money, and the clinic was known as a Rotary TB clinic at that time. We were also involved in the purchase of a Rotary mobile dispensary at that time in the 40s, where this mobile dispensary actually went to the areas which are more remote, away from the city, to the villages, to provide help and really much needed medicine to the people in the villages. And this is a picture in the 50s. You may recognize our past member, PDG Arthur Tevatesan. And this is in the opening of a school that the club, our Rotary Club of Singapore, sponsored back in 1955. And we're also involved in building of another school, a school for lepers, and this is 1952. And we were also involved in the adoption of a village in Jurong. A Jurong village was adopted by our club, and it provided clean water, it provided education for the people there. And not too long ago, fellow Rotarians, this is 1965, not too long ago, you can feel a whole hall of polio victims in Singapore. And this is a picture of in Singapore. You see our past member, past district governor there. All right. And this lady is actually the wife of our first president. And this was in celebration of Malaysia Day in 1965. And we could feel the whole hall with polio victims in Singapore. Fast forward to now. The landscape has changed tremendously. We are very fortunate in Singapore that we are able to afford all the basic necessities in life. We have a fairly good quality of life. But look at these ladies who are sitting in this tent. What is the meaning of quality of life if you cannot see? The Rotary Club of Singapore has been active in the eradication of avoidable blindness for many years, even before 2013, even before Global Grant. But the Global Grant system in 2013 actually was a game changer for our club. And let me share with you why. In 2013, a group of us was invited to visit Odisha in Bhubaneswar, India. And we went there to visit what was known at that time was the Rotary Eye Hospital. It was a very interesting concept for us because prior to that, our club has been involved in doing medical camps and eye camps where eye surgeries are done in remote areas outside the hospital setting. And when the Indian government subsequently banned the running of eye camps outside the hospital setting, there was a big rush, there was a big effort by Rotary itself to set up Rotary Eye Hospitals that can fill this vacuum. And this meeting, for those of you who can identify yourself in here, I can see Suresh, Tapan, and Jimmy here. To me, this was a real game changer. The gentleman on the extreme left was the district governor at that time. And just before this photo was taken, he was on a podium telling us in a very hurried tone, very excited. And he says, Rotary Club Singapore members, give me $25,000 and I'll give you a Rotary Eye Hospital. I couldn't believe what he was saying. I thought I must have heard it wrongly. And I said, Tapan, Suresh, let's talk to him. And he repeated the same claim. He says, Dr. Shahul, Rotary Club of Singapore, you give me $25,000, we will do a global grant and we will have a Rotary Club of Singapore Eye Hospital. And he wasn't kidding. He wasn't kidding because a year later, the building was up and we were really, really proud to know that we have a Rotary Eye Hospital in the state of Odisha in Bhubaneswar. And the hospital has been treating 2,000 to 3,000 patients, correcting eye vision problems, doing intraoral ocular surgery, providing free lenses to the people. And it is a place that all our Rotarians who visit East India and Northeast India have to visit because it's a place where our first Rotary Eye Hospital was built. And we've continued to support this through our global grants, be it equipment, be it training, be it setup of community outreach posts, be it the training of staff and nurses, and of course, the provision of free surgeries. And we're really proud that whenever we visit that place, we must take a photo outside the room that says Rotary Club of Singapore Ward. It's a matter of pride for us. And many thanks to Rotary Club Bouvet National Royal. And in this picture, you have our immediate past district governor, Debashish, who's our main contact there and really a great help. So this continue in Calcutta, in West Bengal area, where we have a great understanding with Rotary clubs in West Bengal. So this is a project with the Joynagar Eye Hospital, with the Rotary Club of Central Calcutta. We supplied equipment and we supplied intraoral lens as well as sponsored the surgeries. And we're also very proud to be associated with another hospital. When we first visited the hospital, the Hooghly Eye Hospital, we had a working relationship with the Rotary Club of Hooghly. And together with our partners in India and all over the world, we were proud to visit the new Rotary Hooghly Eye Hospital that opened soon after 2013 with the help of the global grants. And this, fellow Rotarians, is another site that we must always visit whenever we go to India. But it goes on. We didn't stop there. We didn't stop there. Whenever we get approached to do projects in India, we always say yes, because the eradication of avoidable blindness is something that we feel very strongly. And I must say, this is a picture of past President Allen doing the works for the joint project for the Specialty Eye Care Center, what I think one of the most vibrant clubs in West Bengal, the Rotary Club of Purulia. I know some of them are here. Guys, thank you for all the work. And this was just last year, a group of us visited the same center, and we are very proud to see how well it's run. We are very proud to see how busy the whole place was, and we gave our thanks to all the Rotarians in Rotary Club of Purulia. We had more opportunities. We had more opportunities to go to the state of Bihar, one of the poorest states in the whole of India, where we set up not one, but 2 Rotary Eye Hospitals. Here you have past President Gary in the Rotary Club of Singapore Eye Hospital in Buxa. And then we have another Rotary Eye Hospital in Aurangabad. As you can see a picture here of Gary with RI President-elect, who was, of course, the RI director at that time, Shekhar Mehta, in February 2017. We also moved on to another hospital that we worked really hard with in Odisha itself, the Rotary Club of Cuttack. We provided equipment and again, the sponsor of eye surgeries. But we know something, there's something that we here, even in Rotary Club of Singapore, we know that we have our limits, and we decided to engage some other Rotary clubs in our district, namely Rotary Club of Bugis Junction. And I'm pleased to say that in 2 years ago, the Rotary Club of Bugis Junction established their own eye hospital in Jaipur, in the state of Odisha itself. Other than India, we managed to work with a club in Nigeria to set up what is known as the first Rotary Eye Hospital in Africa. The model was replicated from the projects that we had in India. And this was the culmination of the project where we visited. As you can see, this is a brand new spanking operating theater. It's supposed to be 3 theaters. The partitions are not up yet. So you can see our Honorary Treasurer Manish, as well as our Honorary Member Mohan Vaswani inspecting the facilities. And it's nice to see the whole building coming up from what it was and to a spanking new building. So how did it work? How does it work? It's easy, fellow Rotarians. The land is donated. The Rotary Club, the Rotary Clubs, and the Rotary Global Grants do not pay for the land. The Rotary Clubs and the Rotary Global Grants do not pay for the building. But the clubs and the Rotary Foundation and the Global Grants will pay for the equipment, will pay for the fittings, will pay for the training, and will pay for the surgeries. So as a summary, we also, before that, we also did some projects in our district. And this is a global grant that we did with the Rotary Club of Likas Bay in Sabah. So in summary, you can see our club has been involved with about 25,000 intraoral surgeries, including glaucoma cases, pediatric cases, equipment, eyeglasses, to the tune of about 1.5 million US dollars. The children, fellow Rotarians, the children is our future. The children are our future, whether it comes to education, whether it comes to their health. we are very much involved in children's projects all over the world and through our global grant system. This is a project to supply school-going items to 1,250 school children in Indonesia through our Rotary Clubs of Malang, Central, as well as Rotary Club of Batu, and of course, Rotary Club of Surabaya as well. Some of you are here, so thank you very much for being such great partners and for allowing us to participate in projects there. This project has been going on for years. Through the global grants, we have managed to upscale the whole project from helping a few hundred children to helping a few thousand children. And not only that, we are also involved with the helping of same children who are not able. And this is a project that we've done a couple of times in an orphanage in East Java in Indonesia, where we provide different types of therapy for the disabled children in the orphanage. In Malaysia, Rotary Club of Kuala Lumpur Diraja, who's our sister club, I think they must be very proud of this project. It took years in the making, but right now, no trip to Kuala Lumpur is complete for any Rotarians from our club if you don't visit the children's home, the BRDB Rotary Children's Home in Kuala Lumpur. So this home was partly furnished with a Rotary Global Grant, and our club, together with Rotary Club Makati, are very happy to be part of this project as well. Vietnam. This is in Quang Tri province. This is the province is currently battling the floods. We sponsored through a global grant classroom libraries to all the primary schools in the province. Here we work together with Rotary Club of Marina City, and this is one of our visits there. You can see the children interacting with the Rotarians. The children in India, we've seen the help that we've given. We have to recognize the Rotary Club of Calcutta Metro South. This is their pet project. And this is the school, the village school, a few hours away from central Calcutta, where the children would study here. You can see that no chairs and table, they sit on the floor. Can you imagine, fellow Rotarians, what happened in the monsoon season? What happened in the monsoon season? Classes are disrupted. Through the cooperation with Rotary clubs in and district in Taiwan and the Rotary Club of Singapore, we're happy to report that we are able, together with the Rotary Club of Calcutta Metro South and the Indian clubs, come up with a brand new building for the school. But the work is not done. While we are all happy to visit the school, to witness the inauguration, and the children, you can see, have a proper classroom to attend to, the demand and the work is still there. The need is still there. We still need to feed the children. We still need to clothe the children. We still need to pay for their school fees. We still need to give them an education. So the work of Rotary and Global Grants is not ending anytime soon. Other than helping the students, we are also focusing on increasing the capacity of the teachers through our global grants. So here you see a project where past President Pelita was inaugurating the teachers training program in Indonesia. And the health of the children is something that we feel very strongly as well. Rotary Club Belur, some of them are here. They've gone 2 projects where they treated pediatric children who need heart surgeries in India, as well as children from overseas, from Bangladesh and from Afghanistan, who need similar treatment but couldn't afford it. The children will be sponsored to fly in to Calcutta, and the treatment and the stay will be provided by the grant. I'm also very happy to be part of a small part of a big project with the Rotary Club of Shanghai, with the Gift of Life project, where they do similar pediatric surgeries for those who are in need in the Shanghai area. What happens in Singapore? Like I mentioned earlier in my talk, there are vulnerable people in Singapore as well. Thanks to Rotarian James Lee, this is his favorite project where he was the primary contact. We did an interesting project that has not been tested before. This is a private partnership that the Singapore prisons agreed to do, where we bring trainers from outside the Singapore prison service for second-time drug offenders. Why second-time drug offenders? The rate of offending in Singapore is low. We all know that. But the rate of re-offending is the same, it's high. So research has shown that second-time drug offenders are the best for rehabilitation. So the Architects of Life program, sponsored by the Global Grant System, help to equip and empower these youth at risk while they are still incarcerated, while they are still in the prison service. And some of you may remember that we had the privilege of being invited in to the Singapore Prison Service and to sit in during this program within the prison service to enable us to witness firsthand how this project is being done. Now, we're also involved in other projects for youth offenders. So this is a project for mentoring youth offenders where we train the mentors. This is a handbook done together with Rotary Club of Singapore, as well as our partner, Rotary Club Bhubaneswar Royal. Credit to Rotarian Andy and Rotarian Hassan Musa and past President Alan for the hard work for this project. And another project that we work with at-risk youth is a Football Plus project where we merge soccer, football with life skills and how to say no. And we work together with different agencies to make sure that we can identify this at-risk youth, bring them in to inculcate values together with sports. And again, a pet project of Rotarian James Lee, as well as past President Keith Harrison. What about mental wellness? What about mental health? You hear so many stories going on. Fellow Rotarians, I'm sad to say that the #1 cause of death for youth in Singapore from 15 to 25 is suicide. Every week, 2 young persons in this age group would have committed suicide. So our club is focusing some work on mental health wellness, and we are also we are also aware of the fact that people with mental health problems do not necessarily recover completely. If you're not well, we all know we have the best facilities in Singapore. You can stay for a week, a month, 2 months, 6 months. We have the facilities for that. When you're well, thank you very much. Please go home. But what happens for those who are suffering from mental illness? Do they fully recover? Families are sometimes on edge, not knowing when problems may occur. So our project, known as Club Heal, where we work with an organization that acts as a midway, a halfway house for those who are recovering from mental illness. For first global grant. Now, water and sanitation is something really big as well, and it affects the children. Half the world's population of primary school in developing countries have no access to clean water. A project in Philippines, in Vigan, a project in Colombo, a big project in India, as you can see here with the toilet complex. Another project in Surabaya Timur with the Rotary Club of Surabaya Timur, where we provide water to homes. And another signature project in Cirebon, the picture on top in Indonesia, and the lower picture is a picture of our water project in Vietnam, in central Vietnam, in the province of Hue. Children all over the world can sometimes be disadvantaged in the developing world. We've got a number of big projects going on to sponsor HPV vaccination to prevent cervical cancer for girls between the age of 9 and 14. These are 2 pictures of our projects in India as well as in Lagos, Nigeria. And another project that we are really, really big on is the LIMB project, together with Tolaram Group in Nigeria through our honorary member, Mohan Vaswani. Thank you very much for all the help you've given us. All right, so this is our pet projects. It's really heartbreaking to see young children without limbs. They are already so advantaged in a very disadvantaged country, and yet they need help all the time. If you look at all these young kids, can you imagine how many times they need their limbs to be changed? They can't even afford the first one. They can't even afford the first one. How can they afford another one 2 years later? So Rotary, through global grants, Rotary Club of Singapore, Rotary Club of Lagos Island, and Rotary Club of Victoria Garden City sponsored 3,000 limbs to be given free of charge to the children, to the adults, to those who are in need. The work doesn't stop. We are in collaboration with the Rotary Club in Chennai to sponsor a Children's Cerebral Palsy Center. This was approved, as you can see, during the circuit breaker time. COVID-19 is raging still raging in India. So these projects are still being on hold, not launched yet. And it's another project in the hometown of our past president, Mohandas, in Kerala, physiotherapy equipment for special needs children in Payanur, Kerala. So together, we've put together projects affecting youth and sanitation, 37 global grants to the tune of $3.14 million. Now, a Livelihood Program. This is another aspect that we feel very strongly about in Rotary. Why? Because if you are able to train a skill, you're able to help them to help themselves, that itself is an achievement for those who are really in need. So this is a chicken rearing project in Vietnam, where we help those families who have family members who are disabled. We get them started on 150 chicks and supply them with the necessary antibiotics, training, and materials that's needed to raise the chickens. And we help them with the sale of the chicken as well. And we help them with the purchase of the next round of chicken as well. So this keeps them going and give them a sense of identity, a sense of pride in making their own money. First earthquake in Nepal, we were involved in 3 global grant projects for livelihood. The top one you can see this through organic farming, and the bottom one is through animal husbandry. And the projects are not really just post-disasters. We are also looking at certain areas. We were approached by the Rotary Club of Taiwan, the Taipei, which is our sister club, Gary Huang's club. And we did this project that was approved last year. It's for the training of tea masters. Apparently the need is there, where there's a view that some of these skills might be lost, right? So it's something that we want to protect as well. So other than these projects, we are still very active in other things: hospital equipment, community health centers, dialysis centers, ambulances, diseases for the elderly, dementia, urology diseases. So these are all the different projects that we have to the tune of about $900,000 US. Now, COVID-19. COVID-19 is something really, really big. I'm sorry, I'm taking a lot of time, but I'm going to finish in about 5-6 minutes, all right? Now, COVID-19 is something that's really, really big. And this newspaper article came in, and we saw the problems that we're having in Madhya Pradesh, especially in the city of Indore. It took us just 2 weeks from application to getting the money to distributing the supplies. This is something that I must take my hat off to TRF. For those of you who know me long enough, you know that sometimes I'm very, very critical of TRF when it comes to inefficiencies. But for this, for COVID-19, we really must give them the credit. Some of you was with us when this was launched, the money that was used. And credit to Rotary District 3040, DRFC Dr. Zamin. He was really working so hard, and I was fortunate because it was COVID, it was circuit breaker time, and had enough time, plenty of time, in fact, to work on the grant. And this was recognized in one of the publications in Rotary International. Rotary Club of Belur, I know some of you are here. Thank you very much for giving us this opportunity. Within a short period of time, the grant was put together. And you see the numbers of masks, the numbers of PPEs, the number of face shield that was distributed. Fantastic. Past District Governor and past DRFC, Ravi Segals on the right. And great work by him. And we are always very thankful for his club, which is also our sister club, for giving us this opportunity. Request came in from Pune. Rotary Club of Pune West went ahead, did another COVID-19 project. Sister club, Rotary Club of Moa. This is the distribution of ventilators in a Moa hospital. I know Dr. Senthil may be still here with us, so thank you, Dr. Senthil, for giving us the opportunity. And in Indonesia as well, where 10,000 PCR test kits were distributed very recently through the work with District 3410 and DRSC Eva Kurniati. Singapore. It's not complete if we don't do a project in Singapore for COVID-19, right? So when the numbers kept increasing in Singapore, a few of us came together. We did a global grant project together to the tune of $130,000 US. So in this project, you can see honorary member testing out, looking at the face shield. And this is a factory in Singapore, and we donated 18,000 face shield and 2,000 high-level surgical gowns, as well as a number of reusable masks. So you can see President Dinesh testing out the face shield. And this is the reusable mask that we are looking at, and we are distributing 30,000 of this to the community. I'm glad to say that the last number 90 global grant that was approved is from our sister club in Rotary Club Kawayan in Isabela, Philippines, for the purchase of the PCR machine for COVID-19. So congratulations, RC Kawayan. And altogether, we've been involved with 15 global grants for the COVID-19 pandemic, and this to the tune of almost $1 million. Our work is not done here. We have a number of projects on hold, awaiting approval. 2 in Brazil for our 2 new Rotarians who join us here. Thank you, Luis and Camille. Thank you very much for being the link point between Singapore and Brazil. We are working to do 2 global grants in Brazil, and 1 more global grant with Rotary Club Rizal West is pending for COVID-19. So in Rotary Foundation, we talk about the 3 things. We want to raise awareness. We want to raise funds, of course, so that we can do good in the world. So let me answer the question. I've been asked so many times, why do we donate? What do I get out of it? What can I see? Let me give you some visual. For $10 US, with the matching from Rotary Foundation, you can feed 28 of these children, 28. For $50 US, after the matching from Rotary Foundation, you can give and restore vision to these 2 elderly patients. For $75 US, you can put 1 child to school, either in Indonesia or in Nigeria. And these are real examples. $100 US will pay for each 8 vaccinations. That's for 4 children, 2 doses each. And this is the same, whether it's in India or it's in Nigeria. What about giving limbs? How much do you think this boy needs to have both his limbs restored? You work with this organization called LN4 project. The limbs are free. The limbs are free, but it still costs about $50 to fix the limb. Have you ever thought about riding a bicycle with 1 hand? Have you ever tried rolling a rolling pin with 1 hand? Have you ever done a lot of things with 1 hand? You'll miss it. All right? So, fellow Rotarians, we need you to think about this. What about $100 for this man to walk again? These are the things that we will do, and Rotary Foundation will match so that your money can be stretched. These 3 gentlemen, if you look very carefully, all 3 of them are beneficiaries of our limb projects. And we asked these 3 to be the guests of our special launch for round 2 of our global grant in Nigeria a couple of years ago. So there was a question from the press. What do you feel about getting a new limb? What do you feel about getting this? How do you feel about it? What do you feel about it? He says, thank you very much. And we're all expecting the answer. Thank you very much so that I can walk again. He didn't say that, fellow Rotarians. He says, thank you very much, Rotary, for giving me back my dignity. $100 US for human dignity. This is another true story. After this picture was taken, the father tapped me on the shoulder and said, sir, can I take a photo of you and your friends? I said, sure. So we took a photo and he says, sir, you know why I'm taking the photo? He says, I want to show my daughter, this is the Rotarians who give her the future. Because the little girl was born blinded on both eyes, and there's no way the parents could afford it. Right? And that's the cost of restoring vision. That's what we think. But to the father, to the mother, it's a child's future. And $1,000 US to sponsor a life. So fellow Rotarians, we're not asking for money, right? We're asking you to invest in humanity. What do I mean by that? What do I mean by that? This gentleman, past President Ravi Shankar, when he became president on 1st July 2018, he made a shocking announcement. He donated $14.7 million US. That's 80% of his wealth. So the press asked him, why are you giving away 80% of your money? He says when he was growing up poor. He had to ask help from his neighbors for food. He says nobody ever turned him down. So he says, to me, I'm not giving my money away. I'm giving my money back to society. Right? So Rotary Foundation is a system where they want every Rotarian to support the foundation every year. It's a commitment as a Rotarian. It's a commitment to support your own foundation. And so it's like they say, better to give than to receive. So let's share your treasures. There are many ways to do that. You can contribute $50 a month. You can contribute $50 a year. You can contribute $100 a year. You can contribute $1,000 a year. But this is a commitment that you make as a Rotarian to support all the projects that I've shown you. Or if you are thinking of leaving something behind or thinking of leaving a legacy behind, you can set up an endowment fund where the capital sum is not used at all, but the interest is used to support all the projects that I've shown you. So just have a look at this boy. When I first met him, I thought he looks a bit small for a 6-year-old. He looks more like he's 3 or 4 years old. The reason is because he's undernourished. Budi is undernourished, and something very interesting. He hardly blinked, he hardly smiled, he hardly reacted to anything until I was told he's hearing impaired. Right? Projects like Rotary and Global Grant can help a child like this, already disadvantaged by circumstances beyond his control. So, fellow Rotarians, I hope you'll join us. Hold hands so that we can do more projects. I think we can, not think. I'm sure we can do more than 90 projects in the next 5 to 7 years with all your help. Projects are there, just waiting. Thank you very much.